Working together with Dr. Dorough benefits patients in multiple ways, but whenever you're working with anybody else in the field, it's knowing that you have a full toolkit.
Knowing how to function within your scope, but knowing the tools that are available outside of your scope and knowing how to get that person to the right person is, I think the onus is on us to train ourselves. I had to learn things that Dr. Fallon does that I never got training on, and vice versa. So the more tools I have in my kit to better help the patient, it's the patient's outcome and success that matters most. If everyone comes into me and I have one tool, well, of course, everything is going to be what that tool helps. But the reality is not that. I can't do it all. It's impossible. Not one human can help everyone. So strength in numbers, surrounding yourself with other well-educated people who care, who are compassionate, have good bedside manner. All these nuances to clinical care is something that's extremely important to me and the patients that I see. I'm sure he can agree with that. Has been probably the most beneficial component to helping patients get better faster and stay better longer, with getting them the right person as soon as possible so they don't waste time and money.
The communication is key. With anything we do in medicine, if you just tell a patient to go show up here and don't provide any information, it's like, all right, we have to start fresh, or I don't know what you want me to do here. But with the way that the two of us have worked together, it's, here's a patient, I'm going to send them to you, and then we'll go back and forth about, this is the stuff that I've done, this is the MRI, or this is the x-ray, what could you help with? And at times, it's an evaluation and seeing, is this even appropriate? Can I help? Because that's important. It's not just, hey, you gave me somebody, let's do the things that I would do. It's, okay, do I have the opportunity to help? And I think it's finding people in medicine that you trust to be able to send your patients. Because at the end of the day, anybody I refer to, the patient's going to come back and say, well, I didn't like that guy at all, or that guy helped me a lot. And I want them to say, this person helped me a lot. Thank you for the referral, as opposed to, I can't believe you sent me there, it wasted my time and money.
I think it's really important to collaborate with other physicians because it's an opportunity for me to learn more about something I don't know. And I went out of my way to shadow Dr. Fallon in this surgery OR that he does his thing, to learn more about what he does so I can better triage and recognize when I should send a patient to him or not. Not only will he send me the patient note, the MRI he's already had, his interpretation of that, where to focus, it just makes my job easier as a physician on my side from my training and background. So I have found that true collaboration begins with trust. I trust him. I've actually sent a couple of family members to him because I know he'll do the right thing when it matters most for the patient. And I've heard great feedback from my patients that I sent to him. He's not a person, as I am, to just do something because they think they should for themselves, but he'll act in the patient's best interest if the opportunity is there to help them. So by me knowing what he's doing, and he knows what I'm doing, it enhances collaboration because now the right hand knows what the left hand's doing. And the person who benefits the most from that are patients. That's why Dr. Fallon and I did this begin with in the first place. It was to help people experience a higher quality of life and to figure out, what can I do to help them meet their needs? If I can't help them personally, who do I know and trust that I can send them to help them be a part of the solution and not the problem? And that's why I really value collaborating with Dr. Fallon.